As a physio at Move, seeing women postpartum, this is just talking through what an initial might look like when you first come in postpartum. Obviously, we work really closely with your women's physio, and you would have had some kind of clearance from a GP or a midwife to start exercising 6 weeks. Say Claire's come in postpartum, we would have seen her in the room going comprehensively over her history, what her birth looked like, what she's done since then, and even prior to birth. We're having a look at her abdominal strength before we even get her on a reformer as well, making sure we're nice and comfortable in the space too. Claire's postpartum in this scenario, we've moved into the reformer room, made sure she's nice and comfortable, knows how to change her springs. We've got a bolster here underneath her bottom. One of the exercises that we might start with, which to preface we would have already tested out in a room, made sure Claire's comfortable on a reformer and in this position, would be something like a tabletop. We've already started with a bolster which provides more lumbar support or lower back support and easier for that core control, and can be a really nice starting position when it might have been a while since we used to use those core muscles. All right, Claire, if you want to slowly one at a time, lower those legs into the air. And then I'm feeling for here, trying to draw down your belly button to spine. Great. Now, what I'm looking for here, Claire's got a helping hand with the bolster. What it might look like and what I'm looking for is if she's doming, so if she's trying to get her, just puffing out her tummy and trying to draw in these ribs nice and close. Now, Claire's got beautiful form. It's almost like you've done this before. If we took away the bolster, that would be how we progress it. For Claire who's postpartum in this situation, this is how we might progress that movement. So Claire, I'll get you to put your feet on the bar and we'll just take out this bolster. So now we're taking away a little bit of that extra support. Claire's having to rely on her body cues a whole lot more. So now let's practice that tabletop position again. Drawing down those tummy muscles or belly button to spine, and then same thing, not allowing those ribs to flare. All things that we do at Move, really helping with hands-on advice for Claire's body as well. Another way that we might make this harder for Claire is if you want to grab the short loops either side of your ears, and then arms are going to the sky, and then slowly coming down by your side. Now we're working through more of a dynamic movement, so Claire's having to keep her core on while her limbs are moving. So another way that we can progress it.